Carotid endarterectomy. It is a procedure which is used in the carotid artery atherosclerotic diseases. So it is indicated in a patient where the patient is a medically stable patient who is having asymptomatic carotid atherosclerosis more than 80%, internal carotid artery, stenosis, or if patient has risk of progression to more than 80% despite medical therapy. So what are the indications? We have studied about the indication. Let's study about the contraindication. The absolute contraindication for carotid endarterectomy is when there is a carotid artery complete occlusion. And the other relative contraindication when there is a history of prior neck irradiation due to any kind of a cancer, or such as oral cancer, thyroid cancer, or when the patient is having concurrent tracheostomy, when the patient has undergone prior neck dissection, if the patient is having modified radical neck surgery for in case of any oral or neck tumors, or when there is atypical lesion in the arteries, when there is recurrent carotid stenosis, when the patient is having vocal cord palsy, so due to prior surgical procedure such as endarterectomy only. So these are the absolute contraindication. The history of prior neck irradiation will result in a woody fibrosis because it leads to fibrosis in this skin and subcutaneous tissue, and concurrent tracheostomy might cause an airway compromise after surgery or during surgery also. Prior neck dissection also, where the patient might have received a radiation also. So there might be woody fibrosis where the detection of the artery and the surgical plane will be altered. So how do we approach a patient with carotid endarterectomy? So what are the pre-operative evaluations things? First, you'll take the detailed history and examination part. So within that, what risk factors help us to identify that there is poor outcome. If the age is more than 70 years, if she is a female, if there is severe heart failure, if there is severe pulmonary dysfunction, or when there is renal failure, or when stroke has happened, and this it becomes the indication for endarterectomy. So prior anatomical issues also all has to be considered. So if the patient is having these risk factors, there is increased risk of complication and failure also. So what investigation will be doing in the pre-op evaluation is, first is our work is to rule out the cardiac diseases along with that. So we do 2D echo, or else we can get an exercise stress test, so which helps. And patient, we prior that we do carotid artery duplex study. We get the extent, we will come where the severity of the carotid artery stenosis, all this can be assessed. Brain imaging is also necessary in symptomatic patient. Do CT or MRI, so to assess the if the patient has developed stroke or not. And ENT evaluation also is necessary, such the patient doesn't have vocal cord disturbances. Our next work is to pre-operative preparation. What do we give after the patient we have identified as carotid atherosclerotic disease? We start the patient with low dose heparin. Yes, it is clinically, it is recommended by American Academy of Neurology, and it is recommended for all patients who is symptomatic or asymptomatic, who is undergoing CEA, that is carotid endarterectomy. So this leads to decrease stroke risk and decrease death rate also. If the patient is allergic, choose clopidogrel. There is another study also of dual antiplatelet therapy. Even that has shown proven benefits with using of two antiplatelets help us the patient's carotid stenosis progression also will be decreased. What is the role of statin in these patients? So in the pre-op preparation we start statins also in symptomatic patients. So this is also associated with decreased death rate and decreased stroke risk. Okay, role of antimicrobials. It is given, and if we are using any prosthesis in a patient of vascular surgery in adults, the most common organism which will be infecting is Staph aureus, Staph epidermis, and other gram-negative cocci. So what drugs we start in the for these patients with this? You can use cefazolin or vancomycin or clindamycin also. So what is the anatomy? See, this is the arch of aorta. The left common carotid artery directly arises from the arch of aorta and bifurcates into left internal carotid artery, left external carotid artery, and the right brachiocephalic trunk divides into right common carotid artery, which divides further into internal carotid artery and external carotid artery. And from the brachiocephalic trunk, another vessel which arises, right subclavian. So after knowing this anatomy, here the surgery will be done, where you will dissect the plane, you will turn this along the lines of sternocleidomastoid, you will obtain the vessels, you will clamp it, then do an endarterectomy for the patient. Uh, so during surgery, which anesthesia is preferred? It is given up left to surgery or the anesthetic peoples, so it doesn't have any clinical impact in any impact on the clinical outcomes further. And for assessing the brain perfusion during surgery, we usually do neurological assessment, and which helps us to identify if the patient can develop any perioperative stroke also. After knowing the uh, we'll not go into the details of the surgical aspects of the carotid endarterectomy. We know just it is the basics. Next we'll go for the